And this is how these epidemics occur and have occurred in our society. The condition is known to occur. Everyone understands. Oh, everyone knows there's whiplash. Everyone knows lots of people get back pain. Everyone knows lots of people get carpal tunnel. Everyone knows lots of people get, reflux, GERD, or one of our epidemics. And physicians validate it, of course, because the physicians are only looking below the neck. They're only looking at their little body part. You go to the bone doctor, they look at the bone. You look at the stomach doctor, they look at your stomach. No one's really looking at the whole thing. And insurance covers it, symptoms worsen, and the syndrome begins to take a life of its own. With things like fibromyalgia, there's support groups. And interstitial cystitis, there's support groups. So you see lots of other people who have it, which is very similar to what I described with Dr. Charcot back in France, where you went into the hospital and you saw lots of other people who were ill, and you got worse. And so sometimes support groups actually make people worse. Sometimes defining a disease as a disease makes people worse. So I never say, and some of you have been to me, of course, and I never say fibromyalgia. I say fibromyalgia symptoms, because I don't want to call it that name of a disease, because I don't think it is a disease. I think it's a mind-body syndrome. Let's talk about back pain for a minute. 40 to 60% of people who have no back pain, zero back pain, have abnormal MRIs of the back. They have degenerative discs, they have arthritic changes, spondyloarthropathies, they have bulging discs, herniated discs, facet disorders. All these things are seen in people with no back pain. So if you happen to have back pain and you go to the doctor and you get an MRI, well, it's likely to show that something's wrong. So what has happened now? You walk into the doctor with back pain, you walk out after your MRI with a back problem, a bad back, a disease. And what's the expectation then that you have in your mind? You're going to get worse, or you're not going to get better, because there's something wrong. And when they do these studies, they've also followed people over time. When they follow people over time, there's no correlation between back pain and the MRI findings. In some people, the MRI gets better, back pain gets worse. In other people, the MRI gets worse, back pain gets better. There's no relationship to that. And so we have to understand that medicine is advanced in a lot of ways, but it doesn't understand this mind-body syndrome stuff. And it can lead us astray because of the way it defines illnesses. This is another study from Britain, the exact same thing. Another MRI study with and without back pain, following people over time. No correlation between MRI findings and back pain. And this is a very important article in the New England Journal of Medicine almost 2 years ago now, by a famous orthopedic surgeon from Stanford. And he tells us that these findings on MRIs are common. We would expect that they would happen. And baseline MRIs nor follow-up MRIs are useful predictors of low back pain. And he says MRIs are helpful if you're worried about an infection, cancer, or a fracture. But they're potentially dangerous if you're doing MRIs on people with garden variety back pain, where it's very unlikely they have an infection, a fracture, or a cancer. Because when we make diagnoses based on these imaging studies, we're likely to reinforce the suspicion of serious disease, make people think they're more sick than they are, magnify the importance of nonspecific findings, and label patients with spurious, which means fake or wrong, diagnoses. And it's that labeling that can do us harm. And what's nice for this practice for me is when I see people, they may come in with a list of 2 or 5 or 10 diagnoses, but they may walk out with only one, which is TMS, which is curable, as opposed to 10 which are not curable. And that's a huge benefit that we can provide. And I had a lady last class who was scheduled for back surgery. The surgeon said, yeah, we're going to operate on you. We're going to fuse your spine. And she somehow found me. She somehow found this program. And 2 to 3 weeks later, back was fine. And the surgeons are calling her and saying, well, when are you going to have your surgery? And she's going like, I don't think so. I don't think so. So this study, this was done just this past December, published in the Journal of the American Medical Association, was a randomized trial comparing with people with sciatica, not just regular back pain, but more severe pain that was shooting down the leg, presumably due to nerve, something pressing on the nerve. And even in this situation, was not just garden variety back pain, but with sciatica, even in this case, there was no difference at 2 years between the people who had surgery and the people who didn't have surgery. And if you talk about the garden variety back pain without the sciatica, the surgery is even less effective than in this situation. So there's a lot of operations being done that maybe don't need to be done. For example, here's a study that was published in the New England Journal of Medicine a few years ago now on knee arthroscopy. They were doing knee arthroscopy for arthritis. There were 650,000 of these done per year at a cost of over $3 billion per year in this country. And somebody decided to do a research trial where they did the surgery versus the sham surgery. So this is knee arthroscopy, right? So half the people got the knee arthroscopy for arthritis, where they put the little tubes in and they wash out the knee and clean it up. And the other people went to sleep, got the tubes, got the holes made, but nothing was done. Okay? Fake surgery. And guess what happened? There was no difference between the two groups. And you can see on the slide, there was no difference between the people who had the real surgery and the fake surgery. But a lot of people got better. Why do you think they were doing this? It's because people got better. Why were people getting better? Why were people getting better? They thought they were going to get better. They had something done which was supposedly to make them better. They had surgery. And so what do we call this? It's the placebo effect. It's the idea that if you think you're going to get better, you probably are. And what do we call, here's this extra credit now, what do we call the opposite? Where with the whiplash situation, where you think you're going to get worse. That's called the nocebo effect. It's the opposite. If you think you're going to get worse, you're more likely to get worse. And we're doing that in medicine a lot with these common conditions. And so there's a whole variety of what we call equivalents of TMS that aren't just musculoskeletal type situations, but stomach and stomach problems like irritable bowel syndrome, GERD, non-ulcer dyspepsia. I had a lady the other day, a few months ago now, who had severe stomach pain for 13 years. It was occurring particularly in the fall of the year. And she started, after a while, being unable to work. She started having panic attacks around 4 in the afternoon. Very smart, nice lady, in the medical profession. She came to see me. We talked. It turned out that in the fall of the year, before she started having this pain, her husband, her second husband, had died. And she had had to withdraw treatment from him, pull the plug, so to speak. She grew up Catholic. She felt that was in conflict with her religion, and she had a tremendous amount of guilt about that. She never grieved about it. She quickly got married to another man who was nice enough, but in the fall of the year, he had to go back to work because he's a school teacher and a high school band director, so he was relatively unavailable. And every fall, her pain got worse and worse and worse, and now it's year-round. She came to the class, realized the connection, realized what was causing her illness. She had seen 3 different gastroenterologists. She'd already had her gallbladder taken out. None of that helped. And so she came to the class. She went back and looked at her husband's death certificate because she felt it was related to that. What time do you think he died? 4 o'clock in the afternoon, the time she's having these panic attacks. She put it all together, did some of the work that you're going to be doing. Her pain went away, her panic attacks went away. So it's very powerful, this stuff. A lot of CNS, central nervous system type stuff. A lot of people with dizziness. I've seen a lot of people with ringing in the ears. A lot of people with BPV, or benign positional vertigo. Chronic fatigue, trouble sleeping. We see a lot of that. And a lot of times these will coexist with a lot of the other disorders that we have. When I say we, I'm including myself. I talked already about interstitial cystitis, some sexual dysfunctions, well known that these can be related to stress and mind issues, and a variety of other things. I had a really amazing incident happen here with one of the guys who works at the hospital. He came to a lecture like this. He read Dr. Sarno's book. He realized that his chest pain was due to the stress in his life, because every time he started getting his chest pain, someone had just called him and yelled at him or chewed him out. And as soon as he made that connection, his chest pain went away. And then, a couple weeks later, he noticed that his allergies had cleared up. Now, that was a surprise to me. I was like, wait a minute, how did this happen? Because he'd been on allergy shots and allergy medicine and all this stuff. His allergies cleared up. He was able to walk in the garden and weed and do all this kind of stuff. And so that was amazing. So he wrote that up for me. And then a couple weeks later I saw him. And he told me this story that was very instructive. He told me that he had gone out with another couple, and they had gone home to his house after the movie. His wife and his friend's wife were in the kitchen making some coffee, and he was in the living room talking to this friend of his. And this friend starts telling him how he's depressed, how he's on medication, how he's kind of suicidal. And all of a sudden, the guy that I know now, his eyes start watering, his nose starts running, and he starts coughing. An allergic reaction, right? His allergic reaction. And he doesn't know what's happening, but he excuses himself and he goes to the bathroom. And he's in the bathroom and he's blowing his nose and stuff. And this thought comes into his mind, wow, that got me out of there. And then he realized, that got me out of there. I was so uncomfortable hearing my friend tell me about the depression and the medication and the suicide that I didn't even realize how uncomfortable I was, but my body had the physical reaction to that. And it got me out of there, and I left. And as soon as he realized what it was, his coughing and the sneezing and the nose running went away. And a couple days later, he was having a discussion with his wife about finances. He says, every time we talk about finances, it's stressful. And his nose started running, his eyes started watering, he started coughing again. And then again, going, oh, wow, I guess this is my reaction. And it went away. Very amazing, very how powerful the body can be in understanding how we're feeling. And so this is the physiology, the way Dr. Sarno describes it. Tension in the mind, and particularly in the unconscious mind, where we may not even be aware of it. Leads to activation of the autonomic nervous system, which is in the hypothalamus in the brain. Leads to narrowing of blood vessels temporarily, decreased blood flow, spasm of blood vessels, spasm of muscles, smooth muscles, spasm which can cause pain, diarrhea, constipation, which can cause the bladder type symptoms we talked about, that can cause all the muscle symptoms that we talked about. And that's the result. And so that's how it occurs. There's research evidence that shows that in people with chronic pain syndromes, there's vasoconstriction. There's decreased blood flow to muscles. And in this study here, they put little catheters in the trapezius muscle in people with chronic tension headaches and people without chronic tension headaches. And they found difference in the blood flow, in the muscle, in people with chronic tension headaches. This is another similar study where they looked at muscle tenderness. Even when people weren't having the headache at the time, they showed increased tension in their bodies. Increased tension in their bodies. And when I examine people who come to my office, I frequently find pain and tension in the muscles of people's bodies, even in parts that aren't hurting at the time. Because we're storing tension in our bodies by living life. And people who have TMS, like I do, like most people do in fact, we'll get to that in a minute, store tension in their bodies.